In this video, I will talk about the function of skeletal muscles. This is not about the anatomy of skeletal muscles, it's how they function. So first start with the muscles of facial expression. One of the muscles is called occipitofrontalis, and this is the one that raises the eyebrows. Sometimes if you get a headache, for example, your forehead is painful or the back of your neck is painful, then it's usually the contraction of this muscle, and this is called tension headache. Orbicularis oculi, that is a circular muscle that wraps around the eyes, and the function is to close the eye. Somewhat similar name that is called the orbicularis oris. So this is a circular muscle around the mouth, and that is the one that closes the mouth. And vaccinator, this is a muscle that compresses the cheek and moving the food toward the teeth when you're chewing. Also, it is for sucking, for example, when you're drinking something, and for whistling movements. Some of the smile muscles, you have the zygomatic minor and major. There is also risorius muscle, which is not shown here properly. It's a muscle like this, it's going from the corner of the mouth all the way here. And there is a couple of other muscles like levator labii superioris, levator anguli, oris. Those muscles are not labeled here properly, and those muscles are also for smile. Platysma is a flat muscle on the neck and attaches also in the mandible, and it will depress or brings the mandible downward and also tightens the skin of the neck. Some of the muscles of mastication. You have the masseter muscle. That is the one that closes the jaw. Temporalis muscle that also closes the jaw. And pterygoid muscle. So there's two pterygoid muscles, the lateral and medial pterygoid muscle. So they're also important for chewing and also for jaw excursion, which means that moving the jaw side to side. The muscles of the head and neck. So one important one is called the sternocleidomastoid. This is a muscle that has two different functions. If both of them are contracted from both sides, it flexes the neck. So when you're nodding, for example, you're saying yes. And if one of them flexes, it means the other side. The head moves to the other side. So when you're saying no, you are flexing sternocleidomastoid muscles alternatively. So the function of this muscle is just for saying yes and no, moving the head side to side and also flexing the head. The splenius muscle is located in the posterior part of the neck that can cause extension of the neck, so moving the head backward. Trapezius muscle is a big muscle and has a few different functions. So in this case, for the head and neck, this is causing extension of the neck. And excuse me, and scalene muscles, these are located in the side of the neck. There are three of them, and that can cause flexion of the neck sideways. For some of the muscles in the chest, one is the muscle for breathing. Breathing in, if you are breathing in, so air goes inside, so the chest cavity expands. An important muscle is the diaphragm, so it's around here. Diaphragm is separating the thoracic cavity from the abdominal pelvic cavity. And the other one is the external intercostal. So look at the direction of external intercostal. So it's moving downward and inward, downward and inward. Expiration or breathing out is usually a passive procedure, so you don't need to use any muscles, the air come out. But if you're trying to force expire, so you want to breathe out forcefully, then you can use internal intercostal, this muscle, and you can see the direction of the fibers, so they are going downward and outward. External was like this, downward and inward. Internal is downward and outward. Also innermost, you can see this is deeply located, so you have to dissect these two muscles. You can see this is from inside the chest. This is also a muscle of expiration. The back muscles, so the back muscles are divided into two groups, superficial layer and a deep layer. Both of the layers can cause extension of the spine, so the extension of the spine also causes erector spinae muscles. So for the superficial layer, medially to laterally, you have the spinalis. So this is closer to the vertebral column. Then is the longissimus. This is a long one, and it actually goes here and then goes all the way here. So it's from here all the way to here. And the iliocostalis, which is this one. This is the most lateral one. This coming from ilium all the way to the ribs. So three superficial layers and two deep layers. One is the semispinalis, is this one, semispinalis, and the other one is called the multifidus, which is located medially and inferiorly. So all these muscles cause extension of the spine, or they are also called erector spinae muscles. Muscles that move shoulder. One is serratus anterior. So for the serratus anterior, it rotates the scapula superiorly. For example, when you want to raise your hand to ask a question, when you want to raise your hand to reach something on a shelf, the serratus anterior muscle rotates the scapula so you can reach that. Trapezius muscle has a lot of different functions. One was, I discussed it before, it was extension of the neck. Also, it can cause shoulder elevation, shoulder depression, and shoulder retraction, which means that moving your shoulder backward. And rhomboids, you have two of them, rhomboid minor and rhomboid major. As you can see, it's attached to the medial border of the scapula, so that will cause adduction, moving the scapula toward the vertebral column. Abdomen, you have a few different muscles. One is the rectus abdominis, so it is located beneath this connective tissue sheet. You can see it here. That is the six-pack muscle, some people call it. So that will cause flexion of the abdomen. Also, it brings the rib cage downward. Internal and external oblique muscles. So look at the external oblique, and the same thing as external intercostal. So it's moving downward and inward, like this one. And the internal oblique, located beneath the external oblique, and similar to internal intercostal, the fibers are going downward and outward. They are for flexion of the abdomen and also rotation. And then transversus abdominis, located the deepest layer, and the fibers are going transversely, so like this, in this direction. that just cause compression of the abdomen. It does not cause flexion of the lumbar area. It does not bring the rib cages down, so just the compression of the abdomen. For the shoulder is very flexible joint, so it has a lot of different movements. One is abduction, so moving the upper extremity further away from the torso or from the midline, like this one, this movement. So this is the deltoid muscle and also the supraspinatus muscle. So this is the scapula, and this is the spine of the scapula. So this is the posterior view, and this is the supraspinatus muscle. Adduction, so moving the upper limb toward the torso or toward the midline. You have a few different muscles. One is the pectoralis major, and the other one is the coracobrachialis, this one, the red one. So these two you can see it in the anterior view. The other two you can see better in the posterior view. One is the latissimus dorsi, and the other one is the teres major. This is the teres major. It's a little bit small to see it here. You can also see it in this view, teres major. So these muscles cause adduction. Flexion, so moving the arm like this, anteriorly and upward. One is the pectoralis major, and the other one is the coracobrachialis. Also deltoid participate in flexion. And extension, when you're moving your upper limb backward. So latissimus dorsi, teres major, and also deltoid muscle again. So deltoid muscle has three different functions. One is flexion, the other one is extension, and the major one is actually abduction, abduction. So for the elbow and also for the wrist, an easy way to remember, okay, so the muscles that are located in the anterior part of the upper limb, they are flexors. So they are flexors of the elbow, flexors of the wrist, and flexors of the fingers. So easy way to remember. For example, biceps brachiae, brachialis, you can see all these names. It's written with the flexor, so the name is obvious. Flexor carpi radialis, and flexor carpi ulnaris, and there's also, these are the ones that can cause flexion of the wrist. So the muscles that are in the forearm, they can cause flexion of the wrist or can cause flexion of the fingers. So like this one, flexor digitorum superficialis or flexor digitorum profundus. Those are the muscles that can cause flexion of the fingers, and these other ones can cause flexion of the wrist. Brachyradialis and can also cause flexion of the elbow. So the muscles that are located in the posterior part of the upper limb, they can cause extension. So starting with the arm area, so here you have the triceps muscle, and cuneus is a smaller muscle, but the triceps is the big one in the arm area that can cause extension of the elbow. And then you have some muscles in the forearm that can cause extension of the wrist or fingers. So you can see again the names, extensor carpi radialis longus and brevis here. You have the extensor carpi ulnaris, and you have the then you have some other muscles that are important for the fingers, like extensor digitorum, you can see, and extensor pollicis brevis and pollicis longus, you can have it here. Extensor digiti minimi is there. So these are the ones that can cause extension of the fingers. So easy way to remember the muscles that are located in the back of the upper limb, they can cause extension of the elbow, wrist, and fingers. Hip is also a very mobile joint, so it can cause different movements. One is the flexion of the hip. So this is the flexion, moving your hip area anteriorly. And there are two muscles. One is iliacus, the other one is psoas major, and combined together they are called iliopsoas. So that can cause flexion of the hip. There are some other muscles that can also cause flexion of the hip, like sartorius, that can cause that. Extension of the hip is gluteus maximus. I don't have an image for that. It's located posteriorly. And adduction, so moving the lower limb toward the midline, that is adduction. And so you have a few different muscles. One is the gracilis, so always easy to spot gracilis because this is the most medial muscle in the thigh. Again, this is a little bit difficult to see in this image, but I have a different image in the next slide. You can see it easier. You have the pectineus muscle, and then you have the adductor muscle. So adductor muscles, there are three of them. The adductor magnus is a really big one, and then you have the adductor longus and adductor brevis here. So there's different muscles that can cause adduction. For the knee, extension of the knee caused by quadriceps muscles. So it means there are four different muscles. One is the rectus femoris, the other one is vastus lateralis, there is vastus medialis, and the fourth one that is behind the rectus femoris called vastus intermedius. So just this is behind it. And for the flexion of the knee, you have the hamstring muscle. So three hamstring muscles from lateral to medial. So you have the biceps femoris, this one, it has two heads. You have the semimembranous, which is flat, and then you have the semitendinosus, which is like a tendon. So three muscles, lateral to medial. And you can also see here the gracilis. You see the gracilis muscle here, located most medially, but the gracilis muscle is not part of hamstring. It is an adductor muscle. These muscles that you can see, this is the gluteus maximus muscle you can see here that can cause extension of the hip here. This part of it you can see gluteus medius and gluteus minimus. This is the gluteal group muscles. And these other muscles that I did not mention it here, piriformis and gemellus muscle, superior and inferior, and obturator muscle. These are quadratus femoris. These are the this one. These are lateral rotator muscles. Lateral rotator muscles. Not part of this video, but I just wanted to mention it. So some of the muscles that are affecting the ankle and foot, okay? So you can see that some of the muscles are located in the back part of the leg, and that will cause plantar flexion. So it's moving the foot downward. That's plantar flexion. So where are these muscles? One is the gastrocnemius or gastrocnemius. Both pronunciations are correct. Is this muscle. And if you remove this muscle, then you have the soleus muscle and the tendon of these two muscles together. That makes the Achilles tendon or calcaneal tendon. And then the third muscle is the tibialis posterior. So these are the major muscles that can cause plantar flexion. There are a couple of other muscles, fibularis longus and fibularis brevis. They are located laterally in the leg. They also participate in plantar flexion, but they also cause eversion, so moving the foot outward, eversion. And the dorsiflexion is moving your foot upward, like this, upward. So the important muscle here is the tibialis anterior. But there are some other muscles in this view you can see, and these are the ones that can cause extension of the toe. So like extensor digitorum longa, so these are the ones that goes to the digits and can cause extension of that, or extensors hallucis longus that can cause extension of the big toe. I really hope you enjoyed the video. The video for the anatomy, it will be a different video. This is more the function of the muscles, and the way that I grouped it is based on the movement of the joints. So if you like the video, please subscribe to the channel, and I will upload more videos. So you can press the notification button if you want, and when I upload new videos, you will be able to see it. Thank you for watching.